Hello, I'm Dr. Jay Salpikar. I'm the director of the neuropsychiatry program at Kennedy Krieger Institute and associate professor of psychiatry and neurology at Johns Hopkins University. I recently gave a talk at the American Epilepsy Society meeting in Los Angeles about the overlap between epilepsy and significant behavior problems. A lot of times we see this kind of overlap, sometimes with severe psychiatric symptoms like aggression or impulsivity. Sometimes these are very challenging to treat and even to differentiate as far as what symptoms are coming from the epilepsy and what symptoms might be coming from something else. That's part of our job in our program, is to sort out those kinds of dilemmas. As it turns out, we know that epilepsy is associated with a lot of different psychiatric symptoms, sometimes thought processing problems, cognitive difficulties, and more severely, aggression or impulse control problems. Sometimes we have to think a little bit broadly about these symptoms and think about behavior dimensions. In the talk, I discussed how behavior dimensions might actually cross boundaries between different psychiatric conditions. We can't always use standard criteria to understand the psychiatric symptoms associated with epilepsy. Sometimes we have to think more broadly about impulse control or aggression or other types of problems that might co-occur. As it turns out, a lot of the medicines used for epilepsy are broad and can also be excellent options for psychiatric treatment as well. Many of the medicines used for epilepsy involve the GABAergic system. That's gamma-aminobutyric acid. GABA is everywhere in the brain. It doesn't get all the press that serotonin or dopamine or other more commonly understood neurotransmitters get, but GABA is ubiquitous, and a lot of the anti-seizure medicines improve the function of the GABAergic system. The GABAergic system is involved in inhibition. So if we enhance the GABAergic system, we can stop seizures and even stop aggression or impulsivity. So it turns out that a lot of the medicines that we already use for epilepsy are excellent choices for psychiatric symptoms as well. In case they are not, or if they are insufficient, the good news is that most of the time we can use antidepressants or other psychiatric medicines also. Those medicines can be very safe and effective even in persons with epilepsy. In the talk, I outlined some steps to use for prescribing antidepressants or antipsychotics, and how if we do a deliberate and careful titration, we can often avoid side effects or other problems. The bottom line is that identifying psychiatric comorbidity is very important, especially given how common it is with epilepsy. And if we do improve psychiatric symptoms, we can often go a long way to improving quality of life. Thanks for listening. I'm Dr. Jay Salpikar.